Protocolised care is a specialty at Sughavazhvu healthcare. Essentially, all the treatment that's provisioned through our health centers is based on guidelines that have been developed by international organizations. So that exactly is what protocolized care is all about. So a high-risk individual, essentially can be defined as one who's at risk for certain chronic conditions. That's how I would define high risk. And for different chronic conditions, we have different individuals who are defined as high risk. And I can give you a little example. So for example, individuals who have, for example, hypertension or diabetes are at higher risk for a cardiovascular disease event, and these are individuals that we call high risk. Women who are above the age of 30 are considered to be at high risk for cervical cancer, so they constitute a high risk population again. And similarly, children who are in the age group of 6 months to about 5 years are at high risk for developing conditions like anemia. So they again fall within the group of high risk individuals. So to identify high risk individuals in our population, we have a community-based exercise which is called the Rapid Risk Assessment of the RRA. The RRA is it's an Android-based mobile phone application where we capture a lot of information, including the GPS coordinates of each household. And also certain anthropometric measures such as the height, weight, waist circumference, hip circumference, and the blood pressure of each individual in the household. In addition, we ask a few other questions about dietary habits and smoking and so on. We have specific interventions that we target towards people who are at high risk for different events. So for example, individuals who are identified as being at high risk for a cardiovascular disease event fall within the purview of what we call the CVD or the cardiovascular disease intervention. So once we've identified these people who are at high risk, they come into our health centers and they follow a treatment plan which is provided by our physician who's at the RMHC. And the treatment plan includes both drugs, that's pharmacological treatment, as well as lifestyle modification, depending upon the severity of the condition that the person walks in with. And once this person is provided this treatment within our RMHC, we monitor the person continually to sort of make sure that their risk levels are either brought down or stabilized at some point.